So today we're going to talk about how to use a tennis ball to mobilize the ribs. So we'll get into a little bit about what the ribs can cause, like where do they cause problems. And most of the time people don't even realize that the ribs are even an issue because they feel the problem somewhere else. We're also going to go and look about the mechanics of how the ribs move and why one side gets stuck. And that's what we're going to talk about today. So hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. Oftentimes people have had like 5, 6, 7, 8 different failed treatments before coming in and finding our office. And that's really what we specialize in, and putting the pieces of the puzzle together to figure out like what's truly going on and how we can solve this. So let's get into what the ribs can cause, all the different sources of pain that when ribs don't move correctly that they cause. So we'll start with like the upper part of the body. Really common to have rib issues when you're having some shoulder issues, because if your shoulder blade can't move down and in because the ribs are kind of stuck out, so our shoulder blade's here and it's stuck out, it can't, when we raise our arm up, that shoulder blade is supposed to go down and the ribs are supposed to come in. And when they don't come in and they're kind of stuck out, then what happens is the shoulder gets rounded like this, and then all of a sudden you can't raise your arm up and it starts hurting down this part of the arm. It can happen with the neck too, but really common with the shoulder blade, with the ribs that cause a lot of those issues. It'll also cause issues between the shoulder blades. A lot of that tightness is because the rib mobility is not working properly. And so your muscles will tense up and protect. Other things that people don't realize is that headaches. We've had people that have had issues up in the upper part of these ribs that create headaches. Didn't even realize that that's where some of their headaches were coming from, and that's one of the sources. When it's lower in the back, a lot of times what happens is it will refer pain into the back. You'll also get pain referred this way because that's where the ribs go, but sometimes you don't even realize that it's the tightness in the back that's causing and those lower part of the ribs is causing some back pain. It also can cause hip pain. We've had people that had no back pain, had pain in their hip moved great, back moved great. You're like, this is really weird. Go into the thoracic spine and there it is. You're like, oh my God, that's producing pain in my hip. And the reason why is because all the muscles through here attach into the ribs, like all those ab muscles attach into the ribs, and they also attach to the pelvis. So when they tighten up and they protect, they'll put pressure here, and then you'll also feel the pain down into that hip. And you don't even realize that something's going on up, or you aren't putting the symptoms together that actually things are happening with the ribs. So when we look at like the rib mechanics, like when we breathe in, our ribs expand, and we breathe out, they come back in. That's kind of what the ribs do. So when we actually are moving, like we're rotating, what happens is we get that rotation, and the spine will, or the ribs will kind of move out, and on that one side, it moves in. But if they're stuck out, you can't move in, so all of a sudden you can't rotate. And on the other side, this inside will move in and internally rotate and then come out. So you'll get more extension through here. So what stops you is when your body can't move those ribs to the inside, essentially. So on this side. So if I can't rotate all the way, it's because I can't get that back part usually where the spine attaches to the ribs to actually move in because it's stuck out. And so what we're going to show you today is how you can use a tennis ball to really pinpoint those areas. Now, you'll think that you're rolling over muscle and this muscle tightness, we want to roll over the muscle and that's what's going to relieve the symptoms. No, the symptoms of the muscle are because the ribs aren't moving. So when you go, you're going to hit a spot that doesn't feel very good, and you're not going to roll through it. You're going to press down on it because we're trying to mobilize those ribs to actually move in. And you're going to use your breath to inhale and exhale so that you can really work on just, again, using the breath to help it go in with some extra force through here. So you can put them anywhere. A lot of times, a lot of people have problems in between the shoulder blades. So you can just press it up against the shoulder blade, in between the shoulder blade and the spine. And you'll just kind of go through and just kind of roll, and you'll find a spot that you're like, oh, yeah, that's tight. And then what I'm going to do is I'm literally pushing my body up like this, but I'm exaggerating, but I'm trying to push into those ribs. You can also bring your arm over so it takes that shoulder blade out. It brings the shoulder blade out farther so you can get further into those ribs, and you can push through there as well. That's usually where people are tight up top, is right, you know, bring the shoulder blade over by bringing the arm over and then finding the spots, and you're just going to push and breathe. So you're using the breath to actually bring the ribs in as well with the overpressure. So that's how you can kind of pinpoint some areas of the spine to really open them up. And you'll notice, you're like, oh, wow, it's easier for me to breathe. That feels so much better. That takes a lot of my pain away. So try this exercise, hold it for about a minute, find other spots and hold it for a minute, and comment below and let us know what you think and how it's working, as well as make sure that you subscribe to our channel because we put out content all the time. Go in the description. We have other resources for thoracic spine exercises and things that you can do as well.